Hello everyone, let's learn how to answer an NCLEX question easily using our basic knowledge. Okay, now let's go ahead and read this question. A client arrives at the emergency room reporting lightheadedness, nausea, and a headache that started after consuming cured meat and some leftover food for dinner, along with an artisan wine from a nearby vineyard. The triage nurse notes that the client has been taking phenelzine, and which of the following assessment should be prioritized. So before looking into the options, before reading the option, let's find the key word and summarize the question and understand the question properly. So let's break down this question and analyze it step by step. Please don't freak out when you see some words in the exams which you haven't even heard about, or like which you are not aware about. So for example, in this question, we don't know what cured meat is, artisan wine, or even phenelzine, the medication. If you don't know them, it's okay. Now let's do this. Let's answer this question as if we don't know, we don't have enough knowledge about these words and this medication. But still, we can do this question. So the question is saying that we have a client who is experiencing lightheadedness, nausea, and a headache after consuming cured meat, leftover food, and artisan wine. The client is also taking phenelzine. Many of us may not know what this medication is, but that's okay. We can still answer this question. Now, we don't know for sure if the food they ate is causing these symptoms, and we are not completely sure what this medication is, but let's focus on the key word we know. So we can make a question summary from what we know. So the question summary goes like this. The question is asking, which of the following assessment is most likely related to the symptoms of lightheadedness, nausea, and headache? So this is a summary of the question. Which of the following assessment is most likely related to the symptoms of lightheadedness, nausea, and headache? So now let's go ahead and read the options. Option 1, saturation. Ask yourself, does low saturation cause lightheadedness, nausea, and headache? The answer is no. While low oxygen level can cause symptoms, it's not directly tied to these symptoms, so let's eliminate this option. And now let's go to option 2, blood pressure. Now ask yourself, does high or low blood pressure cause lightheadedness, nausea, and headache? Absolutely yes. In fact, high blood pressure is a common cause of headache, dizziness, and nausea. It is a very basic entry level knowledge, so let's keep this option. Now let's go to option 3, urine output. Ask yourself, would changes in urine output, whether high or low, directly cause lightheadedness, nausea, and headache? Not directly, though changes in urine output could indirectly affect blood pressure, but this is not the most likely cause here, so let's eliminate it. And option 4 is ECG. We use an ECG to check for rhythm abnormalities or chest pain, but in this case there is no mention of chest pain or arrhythmias, so this is not relevant for this situation, so let's eliminate it. So we have only option 2 remaining now, so that is the blood pressure, which could cause lightheadedness, nausea, and a headache. You are able to answer the question with just basic level entry level nursing knowledge. So without knowing the exact role of cured meat, leftover food, artisan wine, or phenelzine, you were able to answer this question. But I have explained the role of these things in the description. Please go ahead and read it. Why I am showing you this is to let you know that if you know the basic entry level knowledge, just the simple fact that hypertensive crisis can cause a headache, you can confidently answer this question. Please understand that NCLEX tests your entry-level nursing competency. So it's not about overloading you with tons of information, a lot of information. It's about using common sense and entry-level knowledge to answer questions effectively. In my classes, I focus on entry-level knowledge, not overwhelming you with a lot of information, excessive details. I use 15 strategies that I have found to be really effective for NCLEX success. So these are not lectures, boring lectures. We learn by doing, like how we do in a workshop. So my next batch starts on April 1, Tuesday. If you are interested, join us to learn the strategies that will help you confidently break NCLEX questions and pass the exam. May God bless you all. Thank you.